Recently, comedian Raju Srivastava suffered a heart attack, and the incident has brought the focus back on how crucial it is to take care of your heart. Now, today we have with us Dr. Ashok Seth, who is the chairperson and cardiologist at Fortis Escorts Heart Institute, Delhi. Thank you so much, doctor, for taking out time and speaking to me.
Pleasure speaking to you.
I'd first like to begin by asking, it's not just Raju Srivastava. There are so many other people in their 20s, 30s, 40s who are getting strokes. Why do you think this is happening?
So I think firstly, we've got to understand that over the last 20 years, heart disease in the young people has been rising.
Yes.
We have clearly seen that the heart disease in young people has risen by 200% over the last 15 years.
Yes. And
we are 10 years at a younger age predisposed to have heart attacks than the West. So the average age is 56 to 57 in India, as opposed to 68 to 69 in the United States.
Okay.
So that's the second aspect. And the third aspect is that we're not just the heart attack capital of the world, but you're also the diabetes and hypertension capital of the world.
Yes.
And these are important risk factors for coronary artery disease. Coupled with that have been lifestyle changes. Clearly, the fact that people are exercising less, more glued to sitting down and working. The atmosphere of competitiveness has increased, so stress factors have increased.
Yes.
Eating out has increased, so trans fat foods have increased. Sedentary lifestyle has become more common, under stress all the time, meeting deadlines in the younger group. And finally, pollution also has a part to play. So all this combined together is a multifactorial issue about rising heart disease in young Indians. To tell you frankly, in the West, death from heart attacks have gone down by 50%, while we have risen by 200% during the same time period. So it is an important problem and has been increasing over the last 15 years.
Right. I think you mentioned one very crucial point here, that is lifestyle. Now, especially in the last 2 years, doctor, we've seen reduced physical activity, gyms were closed, a lot of people were not working out as much. And all of that, together with sedentary lifestyle, as you mentioned, there's been an increase in diabetes, hypertension, smoking, alcohol habits. All of this together has really taken a toll on human health. Now, there's another aspect to it. A lot of people have asked us, it is always recommended to work out and do some physical activity to stay healthy. But a lot of these recent deaths that happened when these people were either in the gym or they were working out. So how much working out is actually healthy?
A very important point, and we talk about lifestyle diseases.
Yeah.
And that's true. Lifestyle diseases are all taken care of by healthy exercise.
Yes.
You raised a very important point, and I want to re-emphasize that. You raised smoking, and I tell you, smoking has increased tremendously.
Absolutely.
Over the last 30 years.
Yes.
And that I still want to advise your viewers is the biggest, most important risk factor for developing heart disease as well as heart attacks, especially in young people and especially suddenly. For example, some of the issues you raised about people severely exercising and getting a heart attack happens commonly more in smokers than in non-smokers, because that leads to thickening of the blood. Right. And suddenly on increased exercise or heavy exercise or severe exercise, clotting precipitates in the heart coronary arteries, especially in smokers, to result in sudden cardiac death or a sudden heart attack.
Right.
So now the very important aspect you raise is that because certain celebrities had heart attacks during exercise, during gymming, or after heavy exercise, has they raised the concern about exactly what you asked, is exercise good for the heart, or what sort of exercise is good for the heart? So we've got to realize that exercise does decrease heart attacks by 25%. But the exercise we say is aerobic exercises for approximately 40 minutes, 5 times a week, which sums up to 200 more than approximately 200 minutes a week,
Hmm.
which therefore means you have a 5 minutes of warm-up period,
Hmm.
35 minutes of brisk walking, and 5 minutes of cool down.
Right.
Brisk walking is termed as a speed at which you're able to speak one sentence adequately, but
Okay.
cannot have a conversation with your friend,
Right.
or are not panting for one sentence. That is heart healthy exercise. Those who have these risk factors should get checkups done regularly. So I say for all males, if there is a family history, your checkups of blood and identification of risk factors, because hypertension can be unknown, can be can be unfelt.
Absolutely.
Diabetes can be unknown or unfelt. Cholesterol levels can be unknown and unfelt. And this is the checkup that you actually have with a doctor to identify the risk factors. And that should start at the age of 20 in those with a family history.
Okay.
In those who have got no risk factors, let's just assume there's no risk factor. One checkup definitely in your late 20s to early 30s is important for all men and women to identify the risk factors.
I think you've made some very crucial points, sir, and I'm sure, at least I am, and the audience is definitely more knowledgeable about how to keep our heart healthy. And most of it, as you said, is about lifestyle choices, the everyday choices that we have to make to look after our heart. I'd again like to thank you, sir, for taking our time and speaking to me. Thank you so much.
Yeah, it's a pleasure talking to you. You've always been very knowledgeable, and your programs are extremely good.
Thank you. Thank you so much, sir.